Well, earlier I spoke to the Health Secretary just after his Commons statement in which he said that cruelty became normal in the NHS and nobody noticed. I began by asking how he justified that statement.
I didn't say it became normal throughout the NHS, but in parts of the NHS, yes. And the way that we're going to deal with that is by turning the NHS into the most transparent healthcare system anywhere in the world. I think we can get there, and we can get back to being really proud of a brilliant institution.
Can you get there, though, without having a word with your friend at the Treasury, George Osborne, and saying that at some point down the track you've got to increase spending beyond levels that it is at the moment?
Well, George Osborne was the one who decided to protect the NHS budget when pretty much every other government department had to be cut.
A 0.1% real terms increase. I mean, that's minuscule, isn't it? Is that enough to make it the world's best?
Well, my point is only in the context of every other department being cut. That is a very strong statement, but it's always a full.
0.1%.
If I could just make my point, it is always a false economy to say that you save money by giving people poor care.
But the extra 3,700 staff that you're recruiting won't make up the number of nursing posts lost since 2010.
Well, we already have more hospital nurses than we had in 2010. As a result of today's announcement, we're going to have even more. And I think we need to make sure that we have more community nurses as well.
So you can absolutely guarantee that there will be more nursing staff, it will make up the number of nursing posts lost. You will more than cover that.
Well, Kathy, as you know, I don't decide the nursing numbers and the doctor numbers in every hospital in the country.
But you preside over the NHS, so you can say that across the board, the number of nurses you're now announcing you'll recruit will more than make up for the number lost.
Well, of course I can't guarantee something I'm not directly responsible for, but what I am responsible for is setting the benchmarks by which hospitals are judged to be a good hospital or not. And what we're changing today is we're making it very clear that it's not possible to be a good hospital or an outstanding hospital unless you're delivering good care. And that means you do need to have the right nursing numbers.
Obviously, we wouldn't be here today talking about this if it weren't for the whistleblowers who you've mentioned by name. But you've rejected the Francis report recommendation to make people legally responsible to report wrongdoing that they see. Why is that?
We've made it a professional duty on all doctors and nurses to support whistleblowers and indeed to speak out themselves if they see something.
Why not a legal duty then?
Well, sometimes if you make things a legal duty, you have unintended consequences. You can create a lot of paperwork and bureaucracy. And doctors and nurses say that one of the problems they have at the moment is that they spend too much time filling out forms and not enough time with patients. So in this case, we thought it was better to have a professional duty, which, let's remember, could mean that they would get struck off and lose their job if they don't do what they should do. So this is a pretty significant sanction, but this is what doctors and nurses want to do anyway, and that's why I think they will welcome this as backing them to do the right thing.